In part 1 of this series, we explored blood flow through the heart, which requires a lot of movement and contraction of the chambers of the heart. But what makes those chambers contract? You're probably not surprised to hear that your body relies pretty heavily on electricity and electrical signals to tell it what to do. That includes your heart. And that electrical system is the driving force behind atrial and ventricular contraction. So in this video, we'll be focusing on the basics of electrical conduction in the heart. There are two types of cells in the heart: conductile, or the cells that create electrical impulses, and contractile, or the cells that change shape to squeeze and contract the chambers. In this series, we aren't going to dig too deeply into the differences in these cell types. Both are closely connected and necessary to the electrical system of the heart, and both types require the same electrolytes to conduct impulses. So, for simplicity's sake, we'll primarily talk about heart cells as one group. But understand that there is more to learn about this if you're interested. Cells in the heart have a few special abilities that allow the heart to function properly. First, we have excitability. This means the ability to stimulate an action potential. An action potential is the first jolt of electricity that triggers a heartbeat. Next is automaticity, the ability to depolarize and repolarize automatically. Cells are polarized, which means they hold an electrical charge that is opposite of the charge outside of the cell in the extracellular space. When a cell depolarizes, the charges inside and outside the cell get closer to being equal, to losing that polarity. Depolarization is what is happening when we refer to that electrical impulse moving through the heart. Repolarization is basically a resetting, or recharging of the cell, making it polarized again and ready to be depolarized for the next heartbeat. I'll illustrate the depolarization process as impulses leaving the cell, and the repolarization process as that impulse returning into the cell. Third, we have conductivity. This basically means communication. When one cell depolarizes, it communicates, or conducts, that message to every cell adjacent to it. The cells that receive that message then depolarize, conducting to every adjacent cell, so on and so forth until every cell in the chamber has depolarized. This conduction happens so quickly that basically every cell in the chamber depolarizes at the same time, bringing us to our final ability, contractility. Contractility is the ability to take that depolarization and turn it into something physical. When a cell releases its energy, it changes shape. It shrinks or contracts just a little bit. Since that depolarization message was conducted to every cell pretty much simultaneously, every cell in the chamber shrinks at the same time, which causes that entire chamber to shrink, or as we call it, contract. And we already learned in part 1 about the importance of contraction for blood movement. Let's go back to a concept from part 1, the cardiac cycle of systole and diastole. Contractions of chambers have to come in their proper order. For a beat to have the best cardiac output, we first have to have atrial contraction, followed by ventricular contraction, followed by a period of rest where no chambers are contracting. Since we know this contraction is happening because of electrical impulses, let's take a look at how that system works and how electricity relates to the cardiac cycle. In a properly functioning heart, the action potential, or that first release of energy, comes from a cluster of cells located at the top of the atrium, known as the sinus node, the SA node, or the sinoatrial node. No matter which name you choose to use, this cluster of cells functions as the primary pacemaker of the heart. In an adult, it creates and releases action potentials 60 to 100 times per minute, at a resting pace. That range should look familiar to you, as it is the normal resting heart rate range for an adult human. When an impulse is released from the SA node, it causes the cells to depolarize, and that impulse is conducted to every cell in both atrium, practically immediately. Specifically, it should take less than 12 100ths of a second, but we'll get into that later. When all those cells release their energy or depolarize at the same time, the atrium contract, giving us atrial systole and providing the atrial kick blood into the ventricles. Now that same impulse has to conduct into the ventricles. But energy doesn't just move from the atrium into the ventricles. That would result in both chambers trying to contract nearly simultaneously, and the atrium wouldn't be able to push blood into the ventricles because the ventricles would be pushing back. We'd lose our atrial kick and have decreased cardiac output because of it. There has to be some separation of atrial and ventricular contractions to allow for that blood movement. But don't worry, the heart has this covered. In order to get into the ventricles, the impulse has to pass through the AV node, or the atrioventricular node. This cluster of cells acts as the gateway from the atrium into the ventricle. The AV node, combined with another cluster of cells that comes off the ventricular side of the AV node, called the bundle of His, create what is known as the AV junction. A junction is where two things are joined, so the AV junction is where the atrium and the ventricle come together. Once the impulse that just caused depolarization of the atrium reaches the AV node receives that impulse, but it slows down how quickly the conduction is taking place. So the impulse slowly travels through the AV junction on its way to the ventricles. This allows the atrium to complete their contraction before the ventricles are signaled to contract. Electricity can travel almost instantly, but the blood that we want to move into the ventricles with that atrial contraction will take longer to physically move. The AV node's slowing of the impulse allows time for atrial kick blood to actually get into the ventricles before the ventricles contract. Once that impulse reaches the end of the bundle of His section of the AV junction, it is released into the ventricles, and again, moves very quickly. But the ventricles are much larger than the atrium, so there is a more elaborate system to speed up this conduction. It's called the bundle branches, or Purkinje system. There are two bundle branches, one that wraps around the right ventricle, and one that wraps around the left. When the signal releases from the bundle of His, it splits and simultaneously travels through the left and right bundle branches, depolarizing each ventricle separately, but at the same time, allowing for this process to be very fast. Specifically, again less than 12/100ths of a second. As the signal causes that quick depolarization of the ventricles, we get ventricular systole, and our cardiac output is pushed throughout the body. Then the cells rest and recharge. This is our diastolic phase. We know that a lot of blood movement and ventricular filling is going on during this phase, but it is also very important for allowing cells to repolarize and get ready for the next beat. That's how a picture-perfect heartbeat should conduct electricity. But if every beat were always perfect, interpreting EKGs would be pretty simple. As you can expect, sometimes things go wrong. Luckily, the heart does have some fail-safes or backup systems in place to cover some of these problems. Let's go back to the AV junction. We know that the SA node should create the action potential for every beat. But what if it can't? Without backups, that'd be it, and we'd die. But we know that every cell has excitability and can create that action potential. So, if the SA node isn't able to beat at least 60 beats per minute, the AV junction is designated to be the backup pacemaker. If it doesn't receive that impulse at 60 beats per minute, it can create its own impulse to keep the heart pumping. The AV junction can create impulses between 40 and 60 beats per minute. Less beats per minute means less blood pumped per minute, so output is negatively impacted, but 40 to 60 is fast enough to keep the body alive and functioning reasonably well. So the AV node can create its own impulses. But the AV node only creates its own impulses when it has to, when the SA node isn't functioning properly. If it receives an impulse from the SA node, it'll continue its primary role and just conduct that impulse into the ventricles. That's a good backup. But what if both the SA node and the AV node can't create their own impulse? What do we do? Die? Well, hopefully not. We have one more backup in place to keep that from happening. Those bundle branches function as the third and final pacemaker of the heart. They can create impulses between 20 and 40 beats per minute. Now, that's not a great rate. Output is severely limited here, but it will hopefully keep the body alive until it can correct the issue. Or, if this person is in a bed in a hospital, keep them alive long enough for us to correct the issue. These backup pacemakers are kept in check by something called overdrive suppression. Basically, the drive to create an impulse from the AV node or bundle branches can be overridden or suppressed if they are receiving impulses faster than they would create them on their own. So, if the AV node receives impulses faster than 60 beats per minute, it never has a need to create its own impulse. If the bundle branches receive an impulse faster than 40 beats per minute, they never have the need to create their own impulse. Without this, the heart would be trying to manage 3 different impulses at 3 different rates to create a heartbeat. It would be impossible to line things up, and the decreased output would lead to likely death. That should cover the basics of electrical activity in the heart. As we move through this series, we'll see how electrical issues will lead to the various arrhythmias we see in our patients. So you may find yourself referencing these basics to help better understand the problems when those issues come into play.